So, learning is divided into two types, which is implicit learning and explicit learning. So, implicit learning is also called as non-declarative learning. Explicit learning is also called as declarative learning. Implicit learning further divided into three more types, which is called as associative, non-associative, and procedural. We can see non-associative learning is further divided into habituation, sensitization, and associative learning is divided into classical conditioning and operant conditioning. So basically we can say a motor learning is an implicit type of learning because motor learning is acquiring a motor skill and simple learning task, which is habituation, sensitization, and classical conditioning. So motor learning is a type of implicit learning, or we can call it as non-declarative learning. So let's see what is non-declarative or non-associative type of learning. So non-associative learning occurs when the individual or any animal has given a single stimulus repeatedly. So as a result of that, your nervous system get or adapt or characterize the activity of the stimulus. Okay. So first we can see habituation. Habituation is the responsiveness to that stimulus will be reduced after a certain period of time. It's called as habituation. So what is the terminology? It is in decrease in responsiveness that occur as a result of repeated exposure to a non-painful. So example of habituation is when we treat a vestibular case, any vestibular case, we give habituation exercises for that patient to reduce its symptoms. Example of dizziness, any type of environmental changes, we use habituation activity to patient in vestibular cases. So example of habituation in your daily life, we can see there is one picture of crow which present in the cornfield. Okay, then the crow was introduced to the scarecrow. After certain period of time, the crows got adapted that the scarecrow is present and we don't have to fear of that scarecrow. They are sitting on the scarecrow. See? Okay. So it's the same. After certain period of time, response to the environmental stimulus becomes habituated and hence a response is not elicited. Habituation is a decrease in responsiveness that occurs as a result of repeated exposure to a non-painful stimulus, said by Kendall-Little. Okay. So MPTs, while you writing in exams, please write the references in the brackets. So as we can see the picture of the railway platform and the home, the people who reside or stay opposite or stay on the railway, opposite to the railway track, get habituated to the sound of the railway after certain period of time. In certain period of time, they are like, it's okay that the railway is going on. So it's the type of typical habituation example in your daily life. So what is sensitization? It is an increased responsiveness. So sensitization, it is an increased responsiveness which is followed a threatening or noxious stimulus. Same author. So for example, in your daily life, if some individual has given me a painful stimulus on the skin while in eyes open, and after certain period of time he asks me to close your eyes and I will give the stimulus, I will remember the previous stimulus he has given me, which was a painful stimulus. And then after even I perceive a light touch, I will react as much as I reacted to the painful stimulus, which is called as sensitization. Okay. So now we are going to see about the associative forms of learning. Associative forms of learning. So it is through associative learning that a person learns to predict a relationship, either a relationship of one stimulus to another, which is called as classical conditioning, or relationship of one behavior to the consequences, which is called as operant conditioning. So we all know the classical conditioning and operant conditioning daily life example, or the experiment which has been done is Pavlov experiment. So classical conditioning, the Pavlov experiment which has been studied how humans and animals learn the association of two stimuli through the simple form of learning that is now called as classical conditioning. It consists of learning two pair of two stimuli. During classical conditioning, an initially weak stimulus, the conditioned stimulus become highly effective in producing a response. When it becomes associated with other stronger stimulus, the unconditioned stimulus will get you the more response. So let's learn this. So there is a scenario of before learning and after learning. Before learning, if you're giving conditioned stimulus repetitively, even you're not getting any response, your unconditioned stimulus will give you unconditioned response. But after learning that process, after performing that activity repeatedly, your conditioned stimulus give you a conditioned response. This is a typical example of classical conditioning. Okay, the Pavlov experiment, as you can see. As we all know, the bell rings and the dog comes for the food and the salivation start. This is the response of the dog after the learning. It's called as classical conditioning. So, for example, we can see in therapy settings, if we repeatedly give patients a verbal cues in the conjunction with the physical assistance when making a movement, they may eventually begins to make a movement with only a verbal cues after a certain period of time, because they have learned that movement. For example, we can see that if you are repeatedly giving a cues to the patient to have to do sit to stand while bending your trunk forward, keeping your knees behind 90 degree, and you have to stand, but after a certain period of time that performance will change into the learning pattern, and that conditioned response which we are giving will give you a conditioned stimulus which we are giving will give you a conditioned response. So it's called as learning has been acquired, learning has been received. Let's see what is operant conditioning. Okay, operant conditioning or instrumental conditioning is the second type of associative learning. Okay, it is basically a trial and error learning. Okay, operant conditioning refers to the process that a behavior produces certain consequences. This response is made first, then reinforcement occur. Let's understand. If the patient is doing a correct activity which we required, we give a patient applause. That is a type of reward which we give to the patient. For example, in a pediatric patient, we give a star to the patient while they have done the very good activity. It's called as a good response for that learning. So it's called that they have acquired certain skills. Okay, when we give treatment to the pediatric patient, we can also see some babies have not done the activity properly. We give certain cues or certain activity that has been like you are doing it wrong, you are doing it. We give the cues which is sometimes punishable activity we give to the pediatric patient. Then there is a punishment response which leads to the correct learning pattern and the incorrect learning pattern, which is basically called as trial and error learning pattern. Okay, so now let's see. The principle of operant conditioning could be stated as follows. Behaviors are rewarded tends to be repeated at a cost of other behavior, and likewise behaviors followed by aversive stimulus are not usually repeated. These are called of law of effect. As we all know, B.F. Skinner example. B.F. Skinner has given the experiment for operant conditioning. So as we have already discussed, operant conditioning can be effective tool in clinical intervention. So if we give verbal praises to the patient, if he has done a very good job, then that process will be learned, that reinforcement which he has acquired will be go on through the therapy. Okay, and we usually reward to pediatric by successful accomplishment of a task desired by the patient is powerful example of, these are the example of operant conditioning. So let's move forward. This is also the same example that we teach the behavior to the individual, that you need to be being polite so that you can get a treat. If your behavior doesn't approve, then you will get a punishment. Okay, this is a typical example. So what is procedural learning? It's another type of non-declarative of implicit learning. Procedural learning refers to if individual is performing the activity very well, he has done very good task, and after a certain period of time, without giving any attention to the task which he has learned, or even the attention or cognitive thought required, it work as like an habit. So we can see the typing example as we have as I have pasted that individual is typing some amount of work. He's typing something and he's typing very slowly, and but after a certain period of time the typing get increased without even seeing the keypad or keyboard. So this is a typical example of procedural learning. It becomes like a habit to individual where the keys are placed. Okay, so procedural learning does not require awareness, attention, or any higher cognitive process. It means that the process has been learned very well. It doesn't require any cognitive processes. Okay, it will be done automatically. Let's learn what is declarative or explicit learning. So declarative learning results in the knowledge that can be consciously recalled and require process such as awareness, attention, and reflection. We have seen procedural learning, which is the opposite of this learning, which is a declarative learning. So it requires awareness, attention, and a reflection. While non-declarative or implicit learning is a more reflexive, automatic, or habitual in characteristic and require frequent repetition for its formation. Okay, we have already discussed. So let's see. In the phase of declarative learning, the individual is trying to learn how to button the shirt. After the stroke, the patient learn how to button and unbutton his shirt. It's a type of area which we teach the patient for fine motor activity. Previously, he learned with more awareness, with cognitive ability, and it's a type of your explicit learning. But after a certain period of time, when he learned that process, that performance converted into the procedural learning. After repetition, that converted into the procedure, which becomes the habit of the individual to do this. So example of sit to stand, which we have already discussed. We give instruction to the patient: first move on the edge of the chair, lean forward, nose over your toes, then stand up. Constant repetition can transfer the declarative learning into the non-declarative or procedural learning. This is the classic example which we give in your daily clinical activities or clinical scenarios. So summary, we have discussed what is motor learning, what is learning, and types of motor learning. So thank you. This is the quote: if you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. This is the learning never stops. This is the quote.